What's the difference between type 1 and type 2?
Type 1, there's no insulin, not much of insulin resistance. Insulin deficiency. In pancreas is gone. It's not producing a drop of insulin.
And why does that happen? Because of lifestyle?
No, not because of lifestyle.
Is
that
it
is
gene
due
expression?
to gene partly and partly due to autoimmunity. The body's immune mechanism suddenly turns around. It's like Indira Gandhi's bodyguard shooting her, So your body sees the pancreas and thinks it's a foreign body. That's called autoimmunity. Immunity is against corona or something else, and that's how it should be bacteria. It should be fighting that. It suddenly gets confused and sees your pancreas and says, there's an invader there, let me go and attack it. And it'll start attacking. That's called autoimmunity. It'll kill every cell in the body.
And it has no reason or like no specific
it can be a trigger. It can be triggered by a virus or something like that, but usually there is a genetic predisposition, not from the father, mother, not that kind of gene, but you have certain HLA patterns, just like your blood groups. There are HLA groups. So if you have certain HLA groups, DR3, DR4, those are the people in whom this autoimmunity will go wrong. And there are many diseases like that. Arthritis, ankylosing spondylitis. There are many other diseases also.
But does it have anything to do with, let's say, tension, lifestyle, sleep, obesity?
Not for type 1. That's more for type 2.
Type 1 can't do anything about it.
Now pumps have come. So you can have AI-driven pumps have come. So if you wear them, the pump takes care of your sugar. All the 4 injections are gone. The pump will find out your own blood sugar level and give you the right amount of insulin without low sugar, without high sugar.
Oh, you don't have to set it? The pumps usually are the ones where you have to set it.
No, you don't have to set also, because the AI is built in. AI will find out your blood sugar and it will inject the right amount of insulin, like autopilot.
But is it risky?
No, not at all.
Because what if technology, one error, one bug, and then it just pumps more?
So good it has become.
But what if like just one bug and it gives you 2 points extra?
You can test your sugar and you can... So far it has not happened. I don't know of anyone in whom it has actually failed. Thousands and thousands of patients, millions actually now on this. The technology is so good. It took about 7 years of research before it was marketed. They tested everything possible. AI has become so good. It's better than human. So good.
So the manual feeding which you had to do with the machine is gone now.
Yeah, that is the older versions. That's all gone.
How expensive is the new machine now?
Expensive. So because only 1 or 2 companies make it, it's about 6.5 lakhs for the pump. But even then it changes your life if you can. Somebody can. So 6.5 lakhs, and then there's a running cost of all the tubing and all you have to get about 20,000 rupees a month.
And how much would like a previous generation pump would cost, where you have to do manual feeding?
2 lakhs. So from there it's gone up.
Cost of maintenance would be 15,000, 20,000.
Yeah, it might have been 10, 15, now it may be 20. So that's not gone up much. The pump cost has gone up. So what we are doing there is we are trying to make it in India. We're working in Indian Institute of Science. We're working with 2 different groups. I'm on the board of Indian Institute of Science. I'm the governing council of Indian Institute of Science, Bangalore. So I go there, I sit with the scientists, trying to make it. They're coming up with protocols. But what they now produce, probably this year or next year, definitely they'll come. I think by end of this year, they'll come. But it's an older version, like the setting and all that they have come to now. They're saying within a year, so within a year or 2, they're saying they can make this. Once they make this, they'll go to the AI thing and they can do it. Then they'll bring it probably for 1 lakh of rupees or something. That's what you're working for.
Got it. So coming back to now type 2. Okay, let's say somebody today got their blood tested and they're now seeing that they are pre-diabetic. They get a notification, they're pre-diabetic, and they're panicking all of a sudden. What is a 3-step checklist that they should do for the next 90 days so that they can probably reverse it or manage it way before it actually becomes a full-blown diabetes?
I mean, you don't have to do it in 90 days. You can do it, or more systematically, you can work on it. Okay. Most people with pre-diabetes have some excess weight and fat. That's the first thing to work on.
Okay.
So you set yourself your 75 kilograms. You should be only 60 kilograms. At least try to make it 65 or 68, 8, 10 kilo. The good news is that while the conversion from pre-diabetes to diabetes is very high in Indians, the reversal is also not very difficult. 5 kilograms is sufficient. If you just reduce 5 kg in weight, especially a little bit of tummy, 2 inches of tummy, and by whatever method, of course, sleep better, sleep on time, don't eat late, all that you said, walk after the thing, set your weight and see that you come down, cut down your carbs, add protein, do regular exercise, aerobics, muscle training, all that, because muscle is where glucose is burnt. If you do these simple things, have a first of all regular lifestyle. If you do all this, it's fairly easy to reverse. From pre-diabetes to reverse is much easier than from diabetes to. See, normal is here, pre-diabetes here, diabetes is here. From here, if you're able to go there, from here to there is much easier to go. Or at least you can prevent going to that stage. It shouldn't be difficult at all. Problem is, people do it for 2-3 months, then they give up. Then they back on.
Why do people give up?
Think they get bored with what they're doing, and they willpower. There are people with terrific willpower, mostly little OCD type people who have to do it once and they overdo it also sometimes. But there are people with willpower who can do it. But right from Adam and Eve, that don't eat that apple, they ate that apple. No, so and then there's what is called a hedonic pleasure. The brain, there is pleasure. And seeing food, seeing a gulab jamun, seeing rasagulla, seeing they just can't. It's like smoking. You can't. It's very easy to say give up smoking. They're not able to do it. It's in your cell. Every cell is telling you to. Very difficult.
So it's alcohol craving.
Food craving.
So our culture is only making us this.
Yeah.
There's one thing which is coming up on the serious point, which is now people are calling type 3 diabetes, which is Alzheimer's. I was reading that for every 1% rise in HbA1c, it means 2 years of brain aging.
Yeah. You can't put an exact number for that, but it's something like that.
Okay, loosely related.
No, but there have been other studies which have shown opposite findings also. See, dementia, if you take dementia, it's of different types. Alzheimer's is one type, where you get this amyloid deposits in the brain and you get amyloid deposits in the pancreas, and that's how the Alzheimer's comes, when you have these deposits in the brain. But there are also other types of dementias. For example, vascular. If you have a stroke, then part of your brain is cut off. So that also can produce dementia. If a frontal part of the brain doesn't get blood circulation, that's also dementia only. Those dementias are definitely higher in people with diabetes, no doubt about it. All the vascular dementias. There have been some studies which are saying that Alzheimer's may be actually less in people with diabetes because they are controlling all the risk factors. They're controlling they're taking statins, bringing the glucose, their cholesterol down. Then their glucose levels are kept under control. Blood pressure is kept under control. They're taking vitamins properly. They're eating a healthy diet. They don't smoke. They don't drink. They cut down on that. Because they have to go for exercise regularly, they do that. So lots of healthy things they're doing, all of which are good for the brain. So there are some studies just saying that Alzheimer's is actually less in people with diabetes. 2 studies I know which have shown that. But uncontrolled diabetes, of course, you don't follow the rules and everything, you're going to accelerate and you're going to get more of Alzheimer's. So they've given it a name, type 3. The reason is, see, the actual class, how this type 3 came, I'll tell you that it's actually not type 3. Type 1 is type 1. Type 2 is type 2. That we know. The last one is gestational diabetes, GDM. Due to pregnancy, it comes. In between, there are about 30-40 different types of diabetes due to stones in the pancreas, due to pancreatic deficiency, due to endocrine disorders, due to drugs, due to virus, due to chemicals, due to this, due to that. So they didn't call it as 3A, B, C, D, E and all. They didn't call it. But because in the classification is 1, 2, last is GDM, and this comes under other types, people started calling it type 3. And the third one, and that is due to the stones. So the type 3C is pancreatic diabetes. Then something else in the thing is Alzheimer related to amyloid deposit. So it's Alzheimer's. That's how the thing came. And just to say it's something similar to what happens in diabetes, something also happens in the brain. So they call it as type 3